independent. He did well until he got out of my clutches, and he always has worked. He's always worked, but he didn't always have jobs that provided health care coverage. After he turned 19 and was no longer under my insurance, the next few years, insulin was difficult for him to get. He didn't have the money, and rather than let me know, which I would have helped him, he rationed it. Well, if I take less insulin and I eat less, then it will last longer for me. And he lived in Portland, Maine at the time, and that's where I'm from, in case you couldn't tell by the accent. And he ended up twice going into diabetic ketoacidosis. And if he hadn't had roommates in his apartment, he would have ended his life on that bathroom floor, because they had to pretty much, excuse me, that was gross. They had to carry him to the hospital. So Matthew is now, fast forward, he's 36 years old, and over the years he's had ups and downs. He does a really good job trying to keep it in control, but he's now been diabetic for 26 years, which is quite a long time. He got an infection on his toe 2 years ago, and trying to have it treated. He did have insurance. The toe eventually broke and poked out through his skin, and he had to have half of his foot amputated. Matthew now lives in Brooklyn, New York. He's a hairdresser in Manhattan. So as you can understand, he did a GoFundMe page. Not so much, he didn't know what his costs would be, but he needed to make money while he couldn't work, and people were very generous out there, so he could pay his bills and pay his rent. His bill was right around $80,000. And he had an option to pay a higher premium for his insurance, which he opted to do because he figured it would be less copay and deductible. So he pays $600 a month for his premium. We believe that making money off of people's illness and misery is wrong and deserves no place in health care. This violates our values as nurses, because we believe that health care is a human right. Yeah. One of the best ways to kick the profit motive out of health care in the United States is to adopt Medicare for all. Health insurance is not the same as health care. Matthew and so many other people need Medicare for all. For a growing number of Americans, insurance is just a policy number on a piece of paper that becomes absolutely useless as soon as you actually get sick and need it. On the other hand, a national single-payer system like Medicare for All lets us focus on providing guaranteed care, not waste money, time, and resources on billing or tracking deductibles and copays, or getting pre-authorization from specialists, or haggling over charges. All the studies show that with Medicare for All, we could cover everyone and save trillions of dollars in the long run. We have never been closer than we are now to having a single-payer system. According to recent polling, 70% of the population supports moving to a Medicare for All system. I know many of you could recite these statistics just as easily as I can, but it doesn't hurt to repeat them over and over and over and over again. And I'm going to, so. Our House bill, H.R. 1384, has 118 co-sponsors. The majority of Democrats in the House support Medicare for All. We had the 3 historic hearings on the bill this spring. Of course, Medicare for All has lots of enemies. The insurance companies, big pharma, and hospital corporations do not want to change a system that works quite well for them. They are happy to make billions off the status quo and continue to profit off of the denial of patient care. They formed a partnership to block our momentum. In 2018 alone, this partnership spent nearly $143 million lobbying against Medicare for All. These folks will fight us with everything they have. They're trying to trick us into accepting a solution that only tinkers around the edges, that makes it look like improvements are being made, but in reality does not disturb the basic structure of our profit-driven system. Our union has fought for decades for guaranteed health care for all. But just under a year ago, as the political climate was rapidly shifting, we knew we had to go all in on this fight and scale up our organization. Just this year alone, volunteers with our campaign, many of whom might be in this room, have helped host over 1,500 door-to-door or street canvasses, knock on over 20,000 doors, attend hundreds of town halls, and text over 150,000 voters to get them to call their legislature. We'll continue this work with thousands of volunteers. We can do this. We must do this. The people of the United States are counting on us to do this. Matthew is counting on us. I am counting on us. Everyone in this room is counting on us. Please ask yourself today how you can be helping to build our movement to win Medicare for all, and let's get busy.